Hi, I am Brian DiGangi, Clinical Associate Professor of Shelter Medicine at the University of Florida, and one of the authors of the second edition of the ASV Guidelines for Standards of Care. Thank you for joining us for this ASV Bootcamp session on sanitation. Two key terminology points are important to discuss before we begin. And it's important to understand that there is a distinction between cleaning, disinfection, and sterilization. Sterilization refers to killing of all life forms. It's not really pertinent to what we're talking about today or general sanitation of animal shelters, but it is important to understand that that's what we're talking about when we're preparing surgical instruments for surgery. That's the most common scenario that we'll find ourselves addressing sterilization. And that is very different from cleaning and disinfection, which is what we think about on a daily basis in animal shelters. Cleaning has two distinct parts. We can be referring to the physical removal of organic materials, so actually going in there and picking up, scooping the poop, removing any of the food, vomit, what other materials might be present in an enclosure, and the chemical removal of contaminants. So that's the use of soaps, detergents, and degreasers to remove things that sometimes we can see and sometimes we can't see these contaminants on a surface before we go on to disinfection. Disinfection then refers to the killing of most pathogens. So cleaning talks about the removal of contaminants, and disinfection addresses the killing of pathogens. So generally we're talking about bacteria and viruses. Occasionally we're talking about spores in this scenario as well. And why it's important to understand this is because cleaning and disinfection are two distinct things and are two distinct steps. When we refer to the term sanitation throughout the guidelines document and through the presentation today, when I'm talking about sanitation, we're talking about the combination of the two, both cleaning and disinfection. So removal of contaminants, then the actual killing of any pathogens that are left behind. So getting into some of the guidelines recommendations themselves, here are a few that I'd like to highlight in this section. First, sanitation protocols should be based on pathogens, routes, and risk of transmission. So they might be different and there might be multiple protocols depending on those things. Sanitation protocols must include steps for removal of organic matter, cleaning, and disinfection. And enclosures must be completely sanitized before being occupied by a different animal. And that's a new statement that we've added in this revision of the guidelines. Make sure it's clear about what should occur when an animal is remaining in its enclosure versus when a brand new animal is coming in. So when we talk about cleaning and disinfection or sanitation, if we combine them together, there are 6 distinct steps that should be followed each time our goal is to actually disinfect an enclosure or a surface. First is to remove the animal and any furniture that may be in place so that we can actually access the environmental surfaces. Second is to remove any of the organic material that's there. So this is the physical cleaning portion of the cleaning and disinfection process. Then we want to apply detergent, some type of soap, and scrub, physically scrubbing the surface to remove all those contaminants. Sometimes we can see them and sometimes we can't. So that's why it's important to do this every time and to actually get in there and scrub with some sort of brush or rag or other cleaning implement. After that, we want to rinse all that material out of the environment. So all the soap and all the contaminants that we've just released, we want to rinse them away from the environment. And then it's time to apply the disinfectant. This way, the disinfectant can come in direct contact with any pathogens that are left behind, and it can do its job the way we expect it to. And then finally, we want to rinse and dry the surfaces so animals don't come back to an environment that's either wet or contaminated with disinfectant or other chemical products. There are 2 QR codes on the page that demonstrate these 6 steps, both for cleaning of dog kennels and for cleaning, disinfecting of crates. Just another note about detergents and degreasers, so that chemical cleaning step that I talked about. And the reason that this has to happen before disinfection can occur is that these products break down organic contaminants and allow them to be removed from the environment. And it has been said that up to 90% of pathogens are actually removed during this physical and chemical cleaning process before you actually apply any disinfectants. And what this does is actually removes all those contaminants, and any pathogens that are left behind, they can actually come in direct contact with that disinfectant so it can do its job and kill them. One of the reasons that this is important to understand is that there are a variety of disinfectant products that we use in daily operations when we're conducting sanitation procedures, and they have different efficacy in the presence of organic contamination. So bleach, for example, is purely a disinfectant. It doesn't have any detergent or soap-containing activity, so it's not going to remove anything from that environment is purely disinfectant. So we have to precede the application of bleach with a chemical detergent. Quaternary ammonium compounds are somewhere in the middle. There are a wide variety of these disinfectant products. Some of them have some activity in the presence of a little bit of organic material, a little bit of contamination of the kennel surface, but it really is variable and not reliable. And then on the other end of the spectrum, we have oxidizing agents, things like hydrogen peroxide-based products and potassium peroxymonosulfate. These products usually maintain some level of efficacy in the presence of organic contamination. Again, it's going to vary, and if our goal is to completely disinfect the surface, we want to be sure that all that organic material is removed so the disinfectant has its best chance of being effective. Thinking a little bit more about the specific protocols that we use, we wanted to address spot cleaning in a bigger way in the revision of this document. So here are a couple of statements that we offered. One is, when an animal will remain in their enclosure and it has not been heavily soiled, daily cleaning can often be accomplished using a spot cleaning method. Spot cleaning should be conducted at least daily when an animal will remain in the same enclosure. So that's a brand new statement giving us some guidance on when spot cleaning is appropriate to use. So to talk a little bit more about spot cleaning, there are a lot of benefits, which I'm sure many of you are familiar with. That's why I wanted to give it a special shout out in this edition of the guidelines. Spot cleaning can reduce stress. It reduces handling of the individual animals that don't have to be taken out of their enclosure every day. It allows them to maintain some of those familiar scents in their environment, so we're not completely cleaning and washing all those familiar scents away on a daily basis. This can be great for shy or under-socialized animals and may even help mitigate disease, especially if we're talking about diseases that are transmitted by fomites. Reduced handling and reduced contact is going to be helpful in that scenario. Here are some steps to spot cleaning to understand why this is slightly different from a sanitation or full cleaning and disinfection protocol. In most cases, and what we're shooting for is that the animal actually stays in their enclosure. So this is when multi-compartment animal enclosures are really beneficial. In addition to all the other good things about them, it can be really useful during the sanitation process if we're doing spot cleaning. We can just move the animal over into the other side of the enclosure and do our work on the unoccupied side. If that's not an option, you can also take advantage of spot cleaning to use this time for some out-of-cage enrichment. You obviously lose the benefits of not having to move the animal out of their enclosure, but we can still gain some of the efficiencies of this process and leave some of those familiar scents in place and take advantage of the time when the animal is not in there. So basically what we want to do is move the animal to a different compartment of the enclosure, remove any of the food and water bowls, anything that's wet and soiled, and we want to physically remove any organic material. So with a dustpan or with a rag, whatever the appropriate tool might be for the situation at hand. Then you want to clean those soiled areas with a detergent. There's not necessarily a need to use a disinfectant in this scenario because we're returning that same healthy animal in most cases to that enclosure. We're just opening back so that they have full access to the multi-compartment enclosure. And so we're just sort of targeting those areas that are specifically soiled rather than cleaning the entire space. And then, of course, wiping it clean and dry to make sure that there's no residue that remains behind before the animal has free reign of the whole space. So I'd like to play just a segment of this video that demonstrates how this might look in practice for cleaning a multi-compartment cat kennel. And if you'd like to see the whole video, the QR code is available there, and we'll give you a little bit more details.
Inspect the unoccupied enclosure. Remove any objects or linens that are soiled or wet. Bedding or objects that are not soiled should be retained and should be placed to the side. Using a clean, dry, or slightly damp rag, sweep any loose debris from the enclosure floor into a dustpan. Inspect the enclosure floor, walls, ceiling, and door for areas with smeared or dried debris. Spray a clean rag or scrub brush with a small amount of detergent solution and scrub any soiled areas. Wipe soiled areas until they are visibly clean. There is no specific contact time required when spot cleaning, but allowing dried debris to soak for a few minutes may facilitate scrubbing. Take care not to allow cleaning products or water to spray or drip into surrounding enclosures through this process. Rinse the clean surfaces with a wet rag or towel. Though areas may be wet, the enclosure should be visibly clean at this time. Dry all enclosure surfaces using a clean towel. Once the enclosure is dry, replace any objects previously removed, such as bedding, toys, or water dishes, and set up the enclosure. Open the portal door and entice the cat to approach using a toy or small food treat. Once the cat moves, close the portal door in preparation for spot cleaning the opposite side. Again, ensuring as little contact as possible with the cat. A cat carrier or den may be used if needed. Repeat this sequence in each occupied enclosure, cleaning each enclosure no more than necessary to produce a visibly clean and comfortable enclosure. Remember to open the portal door and replace your gloves before moving to the next enclosure.
All right, so hopefully you can see how that might be a little bit less labor intensive, a little bit more efficient, and a little bit less stressful for a number of animals in our care. So moving on to specific products, there are a couple of statements that I'd like to highlight here. One is that sanitation products must be diluted and used according to label instructions or published recommendations, and disinfectants used in animal areas must be effective against non-enveloped viruses such as parvovirus, panleukopenia, and calicivirus, since those are some of the most consequential viruses that we may encounter in shelter settings. We have to be sure that we're using the products appropriately and that they can actually be effective against those things when we need them to be. I'm not going to go through all of the disinfectant options available today. There are many out there and there are a lot of resources for you, but this one is a good resource for some of the most commonly used disinfectants in shelter scenarios, and it goes through some of the pros and cons of the different options there. What I would like to do is just briefly go through some myth busting about some of the disinfectants that we see used in a lot of animal shelters. One common misconception is that there is something called a one-step product. There really is no such thing as a one-step product. There are cleaner disinfectant combinations. So what that means is that if your goal is to actually disinfect an enclosure or a surface, killing the majority of pathogens that are there, you actually have to do a pre-cleaning step followed by a disinfectant step. And you may be able to use that combination product to do both of those steps, but both steps are important and they have to occur in that order. And so I've just screenshotted a couple of the instructions from some of the most common disinfectants that we see used in animal shelters, the most common cleaner disinfectant combination products. And so you'll see that each one of them has a step in there that's saying that all the surfaces have to be thoroughly pre-cleaned before you attempt to apply the disinfectant. Another thing to point out is that quaternary ammonium compounds are really commonly used across animal shelters, and many times their label indicates that they might be effective against non-enveloped viruses such as parvovirus or panleukopenia. But a number of scientific studies have shown that that's not necessarily the case, that they're not reliably effective against these viruses. So we have to go back to the chart that I showed you before and some of the other resources to make sure that the product that we're using has been demonstrated independently outside of the product label to be effective against non-enveloped viruses. These products are great for other areas, non-animal areas, or situations where we're not really concerned about some of those non-enveloped viruses that I mentioned, but they should not be relied upon to kill non-enveloped viruses in shelter environments. Another topic is the use of bleach as a disinfectant, and it is a good disinfectant. It's inexpensive and it's readily available. However, bleach is purely a disinfectant. It does not contain any cleaning properties, so that pre-scrub, that pre-cleaning with the detergent really has to occur. It has to occur really well. So bleach does not have any activity if there's any organic contamination left present in the surface. We also have learned that bleach can be effective against ringworm, including spores, and we've relied on that in the past, but we know that there are a lot of other options out there now that are also effective against ringworm, including ringworm spores. So basically any of the most commonly used disinfectants that are available will be effective, so bleach is no longer the only thing that we can use. We think bleach is easy to use. However, there are a lot of rules to follow. So as I mentioned, the surface must be really thoroughly pre-cleaned with a detergent prior to using it. But the product itself has to be stored carefully, has to be diluted appropriately, it has to be remixed every 24 hours, it has to be kept out of sunlight. So there are a lot of things to pay attention to that could make the bleach dilution ineffective and therefore make the sanitation protocol ineffective. So there are a variety of other options that are a little bit easier to use and are widely available now. So we try to save bleach for a last resort if none of the other options are feasible. Another thing that we hear a lot about is the use of UV light, steam cleaning, freezing, or HEPA filtration as alternatives to using chemicals for disinfection. And these have their place and they can be effective in different scenarios, but they should not be relied upon as the only means of disinfection in an animal care facility. They cannot reliably disinfect all the surfaces that we need to be disinfected against some of those more serious pathogens like the non-enveloped viruses that we're concerned about. They can be included as a part of your protocol, but you're still going to have to develop a protocol that includes the use of some of the chemical disinfectants that we talked about earlier. Moving on to some ideas for reducing pathogen spread. As I mentioned, there is a nice section on the use of personal protective equipment, or PPE, in the new version of the guidelines. And so some of the statements I'd like to highlight are these. PPE should be selected based on specific pathogens and exposure risks within each population. As the health of the population varies, the type of protective equipment needed may also vary. Appropriate PPE should be used in each area and disposed of or sanitized before proceeding to care for other animals. And protective garments must be changed between handling each animal when there is a high risk for disease transmission. With these statements, we've tried to create some flexibility in when you use certain types of PPE to make things a little bit easier, but also put up some guardrails so that we know when we really have to pay attention to changing our protective garments, in which areas of the shelter we need to use certain things for. So to that end, we've created this table that's available in the guidelines document that goes through some different and common types of animal populations you might have in your shelter. It really drills down to what are we talking about specifically? When do I need to wear gloves or a gown or shoe covers, depending on which population you're working with. So we've detailed this for healthy animals, non-contagious medical conditions, animals with mild contagious disease, and those with some really high consequence serious diseases like parvovirus or distemper, and come up with some guidelines for different types of protective equipment that you might want to consider building into your protocol if you're dealing with these populations. So you can review that table in the guidelines document itself. So in summary, why does sanitation matter? I think it's important to understand that if we don't engage in really sound sanitation and biosecurity practices, we're going to end up with sick animals. And that means that we're going to drain our resources. That means our adoptions are going to go down. We're going to have complaints both from the public and from our staff as well. And it's likely that euthanasia is going to increase as a result of all of that. The bottom line is that having poor sanitation protocols leads to compromised animal welfare. And so we want to do everything we can to avoid that. Just a few summary points for you. I think sanitation is an area where some of the details really do matter. So you do want to sweat the small stuff. It matters if you're cleaning before you're disinfecting. That's how it's going to be effective. So we want to pay attention to when we're using certain protocols, when we're using certain pieces of equipment, and how we're using them in practice to make sure that those details are being followed the way that we expect them to, so that the end result is what we expect it to be. I mentioned a few times cleaning, whether it's physical and or chemical cleaning, must occur before disinfection. If our goal is to completely disinfect a surface or an environment, killing all the pathogens that are present there, we have to pre-clean that environment first, regardless of the protocol that follows. And then finally, it's important to understand that we can and we should tailor the sanitation protocols to the individual animal needs and the disease risk at hand. So what we do for a group of healthy animals is going to be a little bit different from what we do for a group of sick animals. And even further, depending on the type of illness they might have, we might alter our protocols even further. So this allows us flexibility to use more or less resources as we have available, and to make sure that we put the animals' needs first, keeping them healthy, minimizing stress associated with these protocols, and ultimately setting ourselves up for the best outcomes that are possible. Thank you for your attention, and I look forward to chatting with everyone during the live sessions.